speaker is Serhii Levchenko, who is a PhD candidate at the International Humanitarian University of Odesa. He also serves as an expert of the National Agency of Quality Assurance in Higher Education and is Associated Member of the Odesa Regional State Young Scientists Council. The Young Scientists Council is the representative organization of young researchers in Ukraine. He's a member of working groups 1 and 2 of the ReMO COST Action, and also takes part in the survey special interests group. That we awarded him a virtual mobility grant to perform a survey of the mental health of researchers in Ukraine during the war, and he will present the results of this survey today, and we look forward to hearing about it. So with that, I will open the floor to Serhii and ask him to speak.
Okay, thank you, Brian. My name is Serhii Levchenko. As Brian said, I'm a PhD candidate, and I'm a member of working group on the 2 of this COST Action 1901 and 17. And topic of my today's presentation is the researchers' mental health support during the war case of Ukraine. As you know, that there is ongoing war and full-scale Russian invasion into Ukraine since 21st of February. And many people, including Ukrainian researchers, need for mental support. Some of institutions are organizing events related to mental support, but in addition, there is many researchers which cannot be engaged in their research activities, and current educational system remains hazy. There's also many researchers which cannot work in their institution because it was bombed or occupied by Russian occupants. Some of the institutions are providing mental support by their own mental health services, but the level of its satisfaction may be not on a very high level related to different reasons. Also, the impact of Russian-Ukrainian conflict was researched about when it was on the stage of hybrid war. The studies show that the impact of conflict is stronger as it's close to the conflict zone, and mental health is impacted at earlier stages and more pronounced for males. And in addition, the negative financial impact is stronger on males rather than on females. For this study, I have chosen the survey related to mental health, which is called Work-Related Factors on Research Well-being. It was developed by TIB, but I have adopted it to Ukrainian realities. For analyzing this group, groups were sorted by 5 clusters. It was gender, age, scientific degree, type of higher education institution, and what's mainly interesting, the contact to a psychologist, such as university and private ones. And later it was spread among the Ukrainian scientists in Facebook. The survey was performed in Google Forms from 25th of May to 4th of June 2022. And after the sample was collected, it was analyzed in Stata 16 for Windows. I have chosen non-parametric Kruskal-Wallis test for this analysis. And in addition, questions related to symptoms that researchers feel during their academic activities and mental support actions that they perform were added to the survey. The analysis was carried out by the following clusters: gender, age group, scientific degree, scientific experience, type of ownership of higher education institution, and contact of psychologists. This topic was rarely discussed in Ukrainian scientific community when I was writing this paper, and it was discussed only once in the start of Russian invasion in Ukraine. This survey was made in Google Docs in Ukrainian language and lasted from 28th of May to 1st of June, and was spread among such Facebook social media groups such as Odesa Region State Administration, Young Researchers Council, Ministry of Education, Young Scientists Council, such groups such as Ukrainian researchers worldwide, and group of National Agency of Quality Assurance experts, because almost all of the experts are involved into research activities. This study was aimed only in those part of administrative staff and PhD candidates which took part into researching activities. Those students and administrative staff which is not involved into research activities were excluded from this survey. And in this table, you can see personal data of all of the participants who took part into this research. You can see a differentiation by gender, age group, scientific degree, experience, type of higher education institution, and application for mental support. But I don't see the last two points for those who came, who don't believe to psychologists, and also there's another point, those who don't need their mental support. And for the survey, for these 4 questions, it was used 5-point scale, where 1 is very bad and 5 is very good. And as you see, that university psychologists, most of the participants estimates well, but there's also some amount of participants which gave less good estimation to the university psychologists. But private psychologists is subjectively was estimated be better than university one. And what is also that mental well-being was changed more negatively rather than positively among the Ukrainian researchers, and they're not so motivated for their researching activities during the war. But according to this point, feelings about the future of Ukraine are optimistic, and it was, what should I also say? It's more optimistic was in the time when Russia had more successes in the war rather than now. And I think that at the current moment, level of optimism of Ukrainian researchers may be a little bit higher. But some of them are, but a lot of them never felt relaxed. And what is also good, that a lot of researchers can solve their mental problems on their own. And next we see negative indicators of mental health, and we see a big reaction on feeling nervous and low interest for this research. And the last group of questions, it's indicators which can be such positive and such negative. So that's why I used this -3 and +3 point scale. And in general, impact of these indicators are neutral, except salary or academic mobility, and also a little bit, and also we can see a little bit slightly positive impact of colleagues on mental health. But and after that, here's results of Kruskal-Wallis, a non-parametric test, and I have noted only those probabilities, whereas around or less 0.05 probability of zero hypothesis, and I have also added only them to this table. As you can see from it, none of this factor doesn't react for the optimistic feeling of the future of Ukraine. So that means that almost all of Ukrainian researchers are feeling optimistic about the future. And first, what I have discovered is gender impact. According to this, male researchers, they strongly reacted on such positive indicators such as feeling relaxed, having an ability to make up their minds by themselves, and having more clear thoughts. Instead, female researchers showed more reaction for some negative indicators, such as feeling nervous and on the edge, feeling anxiety and depressed. But the impact of gender doesn't seem for me so significant, because I have found a reaction only on a small number of indicators. The next impact was impact of age. By the age group, the most motivated researchers are the eldest ones, and the lowest motivation was showed by the group 41-15 years old. Also, the youngest researchers demonstrate the lowest interest for research, but the oldest ones show the highest interest for researching activities. Also, young researchers demonstrate a positive impact of their supervisor for their mental health, but the less negative impact of supervisor was shown in group 15-60 years old. I think it is more related because of the family, because of the other problems which may be in their life except researching activities. And also the positive impact of colleagues was also monitored on a group of youngest and oldest researchers. The next impact that was research is impact of scientific degree. By scientific degree, the most motivated researchers are the professors, and the less motivated are PhD students. Also, professors feel themselves more important than PhD and PhD students, because a lot of them may be honorable professors, a lot of them have a bigger and better background. So that's why I think they feel themselves more important. And also, PhD students show the lowest interest in research, and professors show the highest. I think that the reasons of it is the same. Finish there, and by scientific degree, professors are the most motivated than I saw before, but the salary is more positive motivating factors for PhD students and the more negative for PhDs. And the same impact of researchers' mental health give colleagues. And supervisor gives the most positive impact for PhD students or PhD candidates, for others almost on the same level. The next cluster was scientific expertise, and according to that cluster, the least experienced researchers are the most motivated, and they have the most positive impact of salary, supervisor, and colleagues on their mental well-being supervisor. And the most experienced research have the worst impact of supervisor, and the most negative impact of colleagues is being watched by groups 5-10 years of experience and 10-15 years of scientific experience. And by the type of higher education ownership, the only correlation that I have found is the impact of university psychologists, which is the most positive in the private institutions. And here in this picture, you can see my international humanitarian institution when I am studying. And the next group, which is the most significant in this research, is contact to psychologists, because the biggest number of correlations was found in this group. And I have the most interesting results here. Those respondents who contacted to private psychologists almost don't feel themselves depressed, and feel themselves useful with 95% probability. And according to that research and data that I have collected, those researchers who some of the rank for those group which was contacted to a private psychologist was smaller, was fairly small, rather than different groups. And what is also interesting, that respondents who don't need a psychologist, psychological support, they showed mental toughness, and they're estimating their mental state objectively, and they have the less negative impact of the war on their mental well-being. They feel themselves useful with 95% probability. They can solve their problems on their own, and having their clearest thoughts, feeling themselves the least nervous, and show the highest interest for research, and have a positive impact of working condition, working process, supervisor, and colleagues. Those respondents, the respondents showed impact of a university psychologist mostly on an internal environment of an organization and on the factors that is connected with the research activities, such as highest motivation, clear thoughts, and also they have a positive impact of working conditions, salary, supervisor, and colleagues. As I also say, the university psychologists tell to their participants, to its own clients, why the low salary of researcher is good. And the most, but there's only 9 of them claimed about the contact to a university psychologist among all 289 respondents. And the most interesting part of my research, that those researchers who don't believe to a psychologist, they show the most negative change of their mental state. They felt they are the least motivated, and also feel themselves least useful, having the least clear thoughts, the most nervous, and they're having problems with their own control of anxiety, show they're least interested for research and activities, the most depressed, and also have the most negative impact of working conditions, working process, salary, supervisor, and colleagues. And in general, what I would like also say that Ukrainian research, that optimistic feeling of Ukrainian researchers is also a good impact, and they're showing confidence about the successful end of war despite the division into the clusters. This result might tell that in perspective, general level of mental well-being could rise in a peacetime. The most motivating factors among the Ukrainian researchers during the war are feeling optimistic about the future and ability to solve their problems on their own. The most negative impact on mental health cause a low level of salary and academic mobility. In addition, many of researchers feel themselves nervous and on the edge and have low level of research interesting in more in a half of days. Also, among all of the research factors, the impact of gender does not seem so significant because men reacted more positively only on 2 positive factors and women only on 2 negative ones. Other research factors did not show much impact according to this survey. So I think that gender impact is not so significant because of this reaction. There is such impact, but it's really, really low. According to other groups, the highest motivation and research interest among the research aged 60 plus shows that this area in Ukraine doesn't seem so prospective for young researchers, and that's why Ukrainian scientific community is getting older. And this is a problem for the future of Ukrainian science. To avoid this negative impact of this factor, being a scientist in Ukraine should be more competitive on the labor market, and this level could be raised by stimulating young researchers and taking part in grant activities, which should be popularized on all of the levels, from state level to individual level, which can be popularized, for example, by scientific supervisors. As young researchers show positive impact of their supervisor and calling the concept of involvement should young researchers into scientific activities should include this impact. And by scientific degree, situations almost the same. Professors show the highest research interest and feel themselves useful. This can be explained by the fact that the professor understands their involvement and could understand what they could PhD students which do not have a scientific degree react to only one negative indicator, low interest to research activities, but have positive reaction to working conditions, perspectives of raising the salary and abilities of academic mobility, and show the most positive impact on their mental well-being of their colleagues. The way of raising researcher interest could be perspectives of grant, including the clearness of the procedures and academic mobility. And by the scientific experience, the most motivated researchers are those who have the least experience, whose experience is less than 3 years. It can be explained that the sum of those researchers are not the youngest one, and they decided to choose a scientific career not after getting a master's degree, but a little bit later. In addition, they show a positive impact of perspectives of raising salary and academic mobility, supervisor and colleagues. The impact of type of ownership of higher education institution on researcher mental well-being in Ukraine is not so significant because the working conditions in such as in private or in state or communal or specific or special university are almost the same. The only correlation that I have found is that the effectiveness of university psychologists, those respondents who are in private university, they have estimated their university psychologists a little bit better than those responding from other universities. And I think that researchers in all time of higher education institutions feel themselves similar. And the biggest effect on the researchers' mental health was shown by contact of a psychologist, and disbelief psychologists cause strong negative impact on the Ukrainian researchers' mental well-being. In addition, this disbelief indirectly indicates the high level of stigmatization of mental health. That disbelief should be researched further to understand its reasons. Researchers who answered that they do not need their mental support, they showed higher results, and according to this, it can be concluded that this group of researchers estimate its mental well-being indicators objective. In perspective, mental well-being of those researchers will raise without any external support because they can normally control their general mental well-being indicators. Concluding, despite to the subjective estimation of mental support, university psychologists gave positive impact of research on mental well-being by factors that are more related to research activities. And the main disbelief too. Mental support showed a strong negative impact to a researcher's mental well-being. According to the study, the managerial decisions should be aimed for reducing this lack of trust. One of proposed actions for mental support in higher education institution is creating an online app for mental support, and such interventions even showed cost efficiency, and in some studies they caused a potential better allocation of resources within higher education institution. But on the other hand, Ukrainian case showed that having an own mental support specialist give a positive effect on researchers' mental well-being. And in addition, institutional mental health specialists know in ecosystem in institution better than rather than online specialists. Thus, it may also be a competitive advantage for each institution. For example, for getting new students or new teaching staff, for new researchers, and also for the accreditation process of the institution. Also, thank you for the attention. Keep calm and glory to Ukraine.